Once the EVD is connected to the patient's and you need to transport the patient for a CT scan or an MRI, as long as the patient's bed is staying level with the EVD pole and you are not raising or lowering the head of the bed, the EVD should remain open during transport. You would clamp the EVD to the patient when you're changing the position of the head of the bed, and you would re-zero the system through the whole setup going through. As long as the patient's height of the bed and the height of the pole are remaining the same, they should not be clamped during that time. Patients increase their morbidity and mortality from 15 to 35% by clamping for greater than 15 minutes. Any clamp for greater than 15 minutes needs to have a physician order to do so. My thoughts on how you think about this is most of our head CTs are because there's a pupillary change, the kid is seizing, there's a problem, there's an ICP spike. This EVD is considered to be your pop-off valve. We just took away their ability to pop off and drain any of that excess CSF, and we're causing more distress to the head and can cause irreversible damage. We just spoke that the ICP has to be greater than the level that it is at. Raising an EVD from 10 to 15 is sign of progression on the child to see if they can actually have the EVD removed. Getting to 20 and 25 will then look at if it can be clamped. If we are taking the EVD higher and we are now clamping it to go for CT, then we've just now taken any way for them to get any extra CSF and swelling off. And that's where your morbidity and mortality increases greatly.